medical education in Pakistan and transfer of technology. But this time, I think the theme of this year, as our new president, Dr. Rizwan Khalid, put in, is research. And we are going to have a research conference also in um, the I'm sorry, I didn't realize my video was not there. So it was. We are going to have a conference in Rawalpindi Medical University in March, and that will be focused on the research. So now, Dr. Rizwan Khalid will tell more about that also. But this all started with this journey of SITS registry, and this impact study all started with Tiana, who I contacted, I think, 1.5 years ago, because we were looking for an international registry which has validation, which has credibility, which has and of course if it's free, because with the last year COVID and all that, APPNA did not have that much money to spend on, because first I contacted with the American Heart Association here, get with the guideline to get their infrastructure, but they said that we cannot give it for free online, but you can download our forms and use it. And so it took a bit of time, I think over 2 years before we get everything straight. And now we are glad that we are inaugurating this registry, which is out of Sweden. It's an international, widely used in Europe, as well as Middle East and other North African countries. And so SITS were very, graciously, they made a special section for Pakistan. So it's a SITS Pakistan. So this program is about that, as well as the study that later Ali will tell us about. With that, I will ask Dr. Rizwan Khalid to please welcome the guests and tell us about his vision of this year, as well as the conference in Pakistan.
Aslam, thank you, Shahid. Assalamu alaikum, and good day to all illustrious panelists, members attending this particular webinar. I am very thankful to the Merit leadership, Dr. Danish Bhatti and Dr. Shahid Rafiq, for all the work that they have put in, Dr. Babar Rao. I'm very thankful to all the study and registry faculty, the advisors, the presenters. I'm very thankful to the study centers for this particular registry, Rawalpindi Medical University, Fauji Foundation Hospital, the Pakistan Institute of Medical Sciences, and Vaughan Medical College, and all the representatives. I welcome all of you here today. Very thankful to SITS registry and their executive and network coordinator. Welcome to APPNA and APPNA MERIT. Also very thankful, and I welcome our collaborating partners, the Pakistan Society of Neurology, the Pakistan Stroke Society, and the newly formed Pakistan International Neuroscience Society. So I think this is a beginning of one of many endeavors within APPNA and APPNA MERIT that we look forward to, and very successfully, hopefully, we wish them all the success, not just in Pakistan and in North America and anywhere else in the globe as well. We are going to have a meeting primarily focused on research, and then it may have a clinical portion as well, which will be held in Rawalpindi, Islamabad in the first week of March. And whoever can attend, we'll be very happy to accommodate. Also, APPNA MERIT is going to have the center stone presence in APPNA's work, community work this year. And there are numerous other endeavors that APPNA MERIT is doing We have already started the nursing program. We are doing a family medicine diploma. There will be a lot of focus on emergency medicine and cardiology, which is my specialty. So that is something that we are looking forward to this year, and it will continue on in years to come. Also, we are working on creating an umbrella of all the educational endeavors within APNA together under one umbrella, because we have a RISA committee, we have APPNA MERIT, there's the academy, there's a bunch of host committees, host CME committees. So that is one of the things that we're trying to do, is to bring them under one umbrella, and so that there is more organization, more efficiency, there we reduce redundancy, and you know the organization is much better. So that is something that we are looking forward to, working with the Merit Committee, providing all the resources, and looking forward to collaboration with all our partners in Pakistan, in Canada, and around the world on that. So please, again, we welcome you to the current webinar, and also would like to extend our invitation to you to attend our meeting, which is going to be in Rawalpindi in Islamabad in first week of March. Dr. Shahid Rafiq and Dr. Danish Bhatti will give you a little bit more details on that. With that, I will stop. I will hand it over back to Dr. Shahid Rafiq. I will just request the audience that I will not be able to be here for the entire session, because I have to drop my family to the airport in around 30 minutes. So I will be leaving shortly, but I look forward to your counsel and your advice, and good luck with all your endeavors. Thank you very much.
Thank you, Rizwan. And like Rizwan said, that conference that's going to happen in Pakistan, focused on research, Rawalpindi Medical University is hosting this. Like last year, Vice Chancellor Dr. Umar, who's the chief guest for this program, will also let us know about it. The date is 5th of March, and that's Friday, and 5th and 6th of March, 2 days. And I'm hoping that all of us here, especially Dr. Ishfaq Shoaib, Dr. Adnan Qureshi, and others, and Farid also is making program to go, Ali and Asim and other researchers or registry participants. This would be a good chance to meet there. And so with that, I will invite Tiana Todorovic, who is the coordinator and outreach point person for SITS from Sweden. And she will let us know about her vision for Pakistan from SITS.
Thank you very much. Good afternoon from Sweden, and thank you for inviting me here. And also I have my colleague with me. Her name is Isa Ek. We are very happy to participate here today. And we see this as a very important meeting, especially for me. I have been with you from the beginning to create this study, and it's been a very successful journey for us together. And a big honor for me and for SITS to be part of this. So between this collaboration between SITS and APPNA MERIT, we created SITS Pakistan as a special section in SITS to meet the needs of this very important country with a large population, over 220 million people. The aim of SITS Pakistan is to improve safety and care for stroke patients, and which has resulted in this groundbreaking study, the impact study that we have gathered here today for. We have a great confidence in APPNA MERIT team, together with our national coordinator for SITS, Dr. Hussein Hashim. And we are looking forward to having more hospitals becoming part of SITS, and also we are looking forward to many future projects for SITS Pakistan. Unfortunately for me, I'm not going to be able to follow this through, because I have a new job that I will start at in March, but my colleague Isa and the rest of the SITS team will be very happy to continue this collaboration, and I will make sure to follow this from afar. And I'm sending my best of luck to all of you. And it's truly been such an honor and great pleasure to work with you experts. Thank you for that.
Thank you, Tiana. Is Isa wanted to say something, or?
I can just say hi, I'm honored to be here as well, and I will try to do my best to help you in any way. And if you need anything, or you can just let us know and we will help you, and I'm honored to be here.
Sure. Thank you, Isa. Thank you very much, SITS team. Now, the SITS have appointed Dr. Hasnan Hashim, who has had worked with SITS in the past when he was in Dubai in setting up a stroke center there. And he participated in SITS MENA, which is SITS Middle East and North Africa. And that's why they and we also suggested Dr. Hasnan Hashim's name, very very leader in Pakistan's stroke world. So Hasnan, please say a few words for SITS and this, our impact trial. Because your hospital also, you are having, you're wearing two caps. Your hospital is also part of the impact study, and also you're a national coordinator for the SITS Pakistan.
Thank you very much, Dr. Shahid and all other participants for invitation. And really, it's really great. I'm feeling very honored to be part of this great initiative that is directly related to the stroke care in low resource country like Pakistan. So being a national coordinator of SITS Pakistan, it's a really pride for me to represent my country on this international forum. SITS Registry is very vast and has many components. And as Tijana had said that this project is an excellent collaboration between APPNA, SITS and the Pakistan Stroke Society. So I think we can go ahead and we can have more projects in the future with collaboration of APPNA MERIT with the Pakistan Stroke.
So I think a little bit of glitch here. Hasnan, probably we'll get back to you at another time if there's an issue in connectivity. I think I would move on to say, Ali, would you like to present this study so that we know an overview, a brief overview of impact study, and then you will be joined by our other colleagues, Dr. Farid Suri and Dr. Asim from UK, who's present here, if they will pitch in and say a few words after your presentation. Because all three of you have, along with other study coordinators, have played a great role in developing this study. And thank you for that.
Thank you, Dr. Shahid, and thank you, Dr. Danish Bhatti, Dr. Ashfaq Shoaib, Dr. Farid Suri, Dr. Asim, and National Coordinator, Dr. Hasnan Hashim, for making this possible. So I'll briefly present like total of 5 or 6 slides in 5 minutes to give an overview what impact study is about and what we are trying to achieve here. So it basically stands for implementing international standards of practice in a low resource country by blended training modules to improve stroke care in medical units. And that includes medical units, both neurology as well as general medicine. So there are 2 primary goals. The first goal is training for implementation of inpatient acute stroke care quality measures, as get with the guidelines, stroke care measures, and clinical chart documentation of these quality measures. And secondly, to determine the impact of formal training on improved documentation of these quality measures. So the study itself has been divided into various stages, and I'll come across those stages. So the infrastructure we have defined so far are 4 local centers, as pointed out by Dr. Rizwan Khalid: PIMS, PF Hospital, DHQ, and Fauji Foundation Hospital. We here through APPNA MERIT will be acting as the study center. Myself, Dr. Farid Suri, Dr. Asim, and Dr. Shahid Rafiq as the coordinators. We have a local data abstractor team of 3 members. I'm not sure whether the 3 members are here or no, but they will be the ones who will be actually transferring local data to the SITS online portal or registry. They will shift the data from clinical charts to the online portal, and this will be a centralized SITS online portal labeled as SITS Pakistan. So all of the data will be like directly transferred to SITS. And then with these data collection forms and the SITS registry, we will provide reports that how these quality measures are affecting local care in due course of time. So the timelines will be like this. So we have like from here onwards within the presentation, we have 5 stages. These are not like phases, but just the stages to define and categorize the study to make it more meaningful and simpler, and in order to compare the various stages. So the first stage from today lasts till March 31st, and it will be something like this. So in the first stage, we will have retrospective data collected for the preceding 3 months. It can be a bit flexible. We can go from 3 to 6. And it will determine the baseline quality of clinical documentation for stroke that is existing in Pakistan right now. What we will do is we will get a list of patient IDs that will be provided to the study center in the last 3 to 6 months by February 15th, roughly. Then the study center will generate a list of random subjects for which data need to be abstracted amongst these. For example, every 5th or variably something, some other criteria will use to randomize. The data abstraction for these charts will be completed in a period of 6 weeks till March 31st. Simultaneously, there will be a parallel process within stage 1 of training of the data abstractors, the 3 or 4 abstractor team, that will last till February 7th. This will include GCP training and any trainings which Tiana or Isa can elaborate upon, including SITS training for converting the local data on paper charts to online SITS portal. Then we will have evaluation of this data on a sample of first few charts between February 7 to February 23rd to make sure that all the time points are all the quality measures that we are trying to capture are entered within the forms. And if there is something missing, we are pointing out like all the data is being shifted from the paper charts to the online portal. Then this is a timeline for stage 2. So it starts April 1st, lasting May 31st. It's real-time data collection, but in a pre-training phase. This means that whatever resources and whatever training is existing thereby within these units, whether neurological or medical, will be collected. To make sure, here we have 2 units which are neurology, that is PIMS and Fauci Foundation, and 2 that is DHQ and PF Hospital that are general medicine units. So we will also be able to capture data on neurological units versus general medical units. So these centers will be provided with SITS forms. So if I can briefly, I will just go over the form. I wouldn't go into the details to show that we have a separate SITS Pakistan form that's been endorsed by SITS that we will use, and it includes all the patient ID measures as well as the quality measures, including timelines, MRS, NIHSS, and so on. So this is briefly how the SITS Pakistan form looks like. And it captures data from admission, during admission, including complications and all the aspects of core Myers till discharge, and an MRS at discharge and a follow-up at 90 days. Plus, it includes certain appendix Myers that I'll come to afterwards, like NIHSS, STAR-Best, MRS. So coming back to my presentation, and while these forms are being provided to the local team, data will be entered in these forms by local healthcare workers, and entry of the data from the SITS paper charts to the registry will be done by the abstractors. Meanwhile, there will be a parallel process of quality of abstracted data that will be reported and reviewed with the local PI, whoever is being appointed, on monthly basis. Okay. Having said that, as I showed the SITS registry form, by this part of training the abstractor team on the SITS forms, so we will have within the next 2 to 3 weeks meetings with these abstractors, and we will hold 2 sessions, 1 hour each, to go over these forms and to make sure like they have the understanding of whatever is being collected on the paper chart is correct and is being shifted to the online portal through SITS training. The third stage will start on June 1st and last till June 30th. So this will be training of the healthcare takers, including training of nurses, paramedical staff, and the physicians within the departments at the 4 centers. It will be 8 hours of crash training, 2 hours training every week. And the curriculum will include an IHSS, modifying Rankin scale, dysphagia screen, other training pertinent to core Myers. And we have identified certain resources regarding certification with these training curriculum. Having said that, we will need the certifications from individual people to make sure that the training is done correctly. And when we move towards the final implementation stage, everything is being certified. We will help whatever is not available online to either make it in person through local coordinators or holding live sessions with the people who need to be trained in this stage. And then we move towards the final stage of implementation between July 1st to December 31st. So we have kept it a bit longer to capture as more data as possible. So this will be real-time data collection in the post-training phase after these core care Myers have been implemented. The documentation is being implemented and these certifications are in place. So data will be entered in the SIT forms by local healthcare workers, will be shifted from paper charts to online SITS portal by the APPNA MERIT abstractors. And in parallel, we'll have monthly review of the data with the local PI. And finally, by the end of this year and the start of next year, then we will have all the data on the SITS online portal that will be analyzed and reported with manuscript preparation and submission. Having said that, so there are a few points that will be implemented and will be a little bit new. So the idea is to implement the AHA core care Myers according to Get With the guidelines without using accessory resources within this existing setup of Pakistan. So as patient arrives to AD and stroke is being identified, so this is a Meyer we will introduce, that is the stroke code activation, which means that a person that will be identified by the department will come to the AD and will decide whether patient needs to go to the stroke team or needs to be handed over. If the team is taking over, they'll go with the imaging, they will assess, transfer to the ward right away, whether medical or neurology unit. And the core care Myers will be implemented right away at that point in time. We will go into the details of the core care Myers afterwards in subsequent meetings. And then there will be blended rounds and care. By this, we mean that while the rounds are being headed by the local personnel, head of department or neurologists and physicians. So there will be a sort of blended communication between physicians from here and Pakistan, from North America and Pakistan, with implementation of these certifications and discussions with the PI, including online workshops regarding those certifications to make sure core care measures are being implemented. The data is being recorded, including primary and secondary measures, and subsequently the completion of the study and publication of results. This also includes deciding disposition of patients at discharge while patients are being exited from the care delivery, and a follow-up that will be planned at 90 days. So these three are sort of three points which will be sort of within the existing resources. They will be introduced, but they will be captured during the course of the study. With this, I'll conclude. And once the study is completed, the disposition of results will be discussed with local PI that what needs to be improved further on. I will invite Dr. Suri or Dr. Asim if they want to comment something else on the presentation, and then to Dr. Shahid.
Dr. Suri, please add. I think we discussed that because of the COVID situation in Pakistan and of course here as well, but in particular in terms of data extraction and even for the retrospective phase, we may move these stages to some extent a month or two forward. So this timeline is not fixed, set in stone. But please say a few words and then Asim.
Yeah. Thank you. Assalamu alaikum, everybody. I'm really proud to be part of this project, and great study. But as the audience has asked a question about the abstractors, so initially we have got a junior doctors which are part of taking the data from the case notes which would be provided by the local coordinators. But I must say that for later on, might be the junior doctors might not be available. So might be we have to look into it, Shahid bhai, that we can see that local data collectors can be identified in each hospital. That would be useful, not only during the phase of the study, but also later on to maintain it later on. That's all I have to say. And obviously, it will generate a lot of questions later on with the local coordinators. Would be happy to answer those. Thank you.
Thank you, Asim. Fareed, if you are there and would like to add a few.
So thank you, Dr. Shahid. I think Ali covered everything very nicely and very comprehensively. If you are very excited to be part of this project and see how we can, as you mentioned, that this is just a pilot kind of project, and the goal is to extend all of these quality measures to all the hospitals in Pakistan. Do you want me to, do we have enough time to talk about the stroke course research project, or you think?
Right, if there are other, because it's a good time to add because we are running the stroke course and you have contacted the attendees or fellows of that course and given them or getting some feedback from them in terms of further future stroke projects. So tell us about that in next one or 2 minutes.
Yeah, so can you see my slide? Or 1 second. Okay, can you see it now? Okay. Yeah, so just briefly going over that, we have started the stroke course. We are in the middle of that stroke course right now. It is a 9-month course with 17 trainees currently inducted in that course, and it is planned to finish by end of June. It is 9 months of basically didactics and case discussions. But once we started the course, we were very enthusiastic about promoting the research in Pakistan. So we added an additional optional 3 months of research dedicated track. It is a 3-month additional after June. So basically it means that July, August, and September, 3 months, but the research projects are planned to be started now, and we are kind of like started to work on that now. So basically they have 8 to 9 months to design and complete a study. It's a little kind of like as you see, it's a somewhat of a short time, but the idea is that to get trainees and exposure during or this limited time. There are 13 out of those 17 trainees enrolled in that, which is very exciting. And all research trainees are assigned the primary research faculty. In addition, there will be a secondary research faculty to ensure that we have enough statistical coverage for any statistical analysis. The things that we are going to do during that is first discuss the idea with the primary faculty. Then they are going to submit the idea for approval. And then after it is approved, then they are asked to submit a formal proposal for the research. Then after that proposal is been brought up and discussed with the panel, then they're said that, okay, this looks fine, or it is tweaked or modified, and then they go ahead and prepare the protocol and forms and start doing the data collection. The data is, the research faculty has, all the faculties that have been assigned to the research, they have good experience with research, and they will guide them through all of these steps, and electronic data entry, and then data clinic and data analysis, and finally the preparation of the manuscript. What we have done is collected like a baseline data about the trainee research profile, like what center they are working in, how much volume of strokes they are seeing, what's their level of involvement in the stroke, and what kind of facilities are available in that center. And based on that, made a table, and then see which faculty can be assigned that would be more appropriate for them. It's not a straightforward task, especially, with the limitations. You can see that some of them are kind of like have a limited role they are not at a senior level where they have a full control of all the research, but still it's something that we will try to work with them and try to see if we can at least train them in how the research is formally done. So thank you, Dr. Shahid, for giving me this opportunity. Any questions?
Thank you, Farid. If we will have any questions in the end of the program, we can discuss and make it more interactive. But I think we have a long list of our guests and experts and friends who are always have been a great support for any APPNA MERIT program, but particularly this group for stroke and neurology. I had in the program at this point calling Dr. Ashfaq Shoaib, but I think, with his stature and his wisdom, I would like him to come at the end before our chief guest remark, so that he can listen to everybody and study centers and collaborating organizations, and then give us his, guidance and advice. So I would move it further along the program. At this point, I would like to invite the study centers. So we have 4 study centers, and it's in the same region, metro region of Rawalpindi, Islamabad. And our SITS national coordinator is also there. So any problem with the SITS registry or something, it's easier for Dr. Hashim to address that. But obviously, this is just a study. But SITS registry is open to all the hospitals in Pakistan, and I know that there are certain doctors like Waqar Hafiz is here from Maroof Hospital, and we'll give him a chance a little later, and Imjad from Jhang and others who are willing or eager to enroll their programs in the registry, which will happen. But I would like to invite at this point please mute your phone if you're not speaking. Thank you. I would like to invite a principal of Wa Medical College, Dr. Wasimuddin, Professor Wasimuddin, to say a few words. I know that it's close to my heart. I belong to Wa, and he belongs to Wa, and he told me many years ago that if stroke can be experimented in Pakistan, even acute stroke or hyperacute or thrombectomy and others, VA could be a very good place because it's very organized. It has an sort of EMS system. Ambulances are very efficient. And I know that PF Hospital and VA Medical College are very organized program. So we are looking forward to further collaboration beyond this study. So Dr. Wasimuddin, please say a few words.
Assalamu alaikum, everybody. I must congratulate APPNA MERIT and all those who have been involved in designing this study. I think this is a very practical approach in a country like Pakistan. And I think the mix that we have got is of 2 neurology centers and 2 general medical units. Because this is where strokes are being managed in Pakistan, actually. Very few hospitals, except in large cities, would have dedicated neurology centers. My team is very eager. Dr. Turab, one of my colleagues, has stimulated a lot of interest in our junior consultants, our nurses, and our physiotherapists. So we're looking forward to very fruitful next 6 months or possibly a year. So all the best from VA. VA has got a special flavor besides the EMS system, which Shahid, I think, peculiar to Pakistan, we have got a very close community, which is an excellent follow-up. I think so. This will add to our good follow-up in the study. So wishing you all the best. So this is all from VA.
Thank you, Wasim Bhai. And I should also mention that our study faculty, Dr. Asim Ali, is also from VA. So a lot of representation from VA. So I would like to say if Dr. Turab is there and would like to say a few words. She is the coordinator from PF Hospital Walk-in. If not, then we can come back to her. I don't know if she has a mic.
Yes. Assalamu alaikum.
Go ahead, Dr. Turab.
Thank you very much for giving me an opportunity to say just a few words. As Dr. Wasim said, that our setup is like that we can be a very good source of giving you data, and then the pre-study and the post-study data. And not only that, it will help in analyzing or getting to know the actual status of stroke care in Pakistan, but it will help our colleagues and our other junior staffs and nursing staff to get trained, because our main aim is not the study, it is the objective of giving a better care to our patients. So I'm interested in both of these things, that to have a look at the actual status that is being done presently, and what objective are we going to achieve with the different care training programs and blended learning as you have suggested.
Yeah, thank you, Dr. Turab. Of course, that is the main focus of MERIT is the medical education in Pakistan. And research is a way to do things and measure the outcome of any project, any program that we do. But definitely the education, as you have seen in the third phase, not only the education, but also the monthly round with the stroke team in each of the centers. So what we would like to say that with how much training or with minimal or more training, different other hospitals in Pakistan, these are the hospitals which are fortunately in the cities or near cities, but there are so many hospitals far-flung areas where they do not have much. So we hope to enroll them, most of the hospitals in stroke registry, and measure their outcome as we train them. And so basically our thing is not that we would be doing this years after years after years. What our hope is that these 4 hospitals their teams will become leader, and under Dr. Hasnan Hashim's national program of registry, uh, and Pakistan Stroke Society, Dr. Anjum, the president, is here. They will own. This is their program. Ownership of the program lies with the Pakistan. Ownership of the program lies with Pakistan Stroke Society, Pakistan Neurology Society, and of course the SITS Registry National Coordinator. And so we are just here to assist and educate, of course, along the way. But we think that we are training the trainers. So all of you guys, all of you professionals will be the teachers of tomorrow. The way we will set up these 4 hospitals, then it should have a domino effect. So I would next invite Dr. Tanveer Khalik, who is my friend and class fellow, now the VC of Shahid Zulfikar Ali Bhutto University. And then after that, the PIMS team, I think Dr. Mazhar Badshah is here. He is the head of neurology department of PIMS. And I'm really honored that he's here. So after Tanveer, he will have 2 words. So Tanveer, go ahead and give us your intake.
Right. Bismillah ar-Rahman ar-Rahim. Very pleased to see Wasimuddin, Professor Wasimuddin, and Rao Babar, my college fellows, senior college fellows. Assalamu alaikum, Wasim Saab. PIMS, you all know, is one of the largest tertiary care hospital of the capital, more than 1,500 beds and a ER attendance of about 1,500 to 2,000 patients in 24 hours. It's a big number. And I was talking to Haris this afternoon, and he told me that the pre-COVID, we used to receive 4 to 8 patients of strokes per day, which was a big number, and also something new for me as well. So PIMS as a dedicated unit of neurology headed by Mazhar Badshah, is a very competent neurologist. We don't have a dedicated stroke center, of course, over here. So it is a 30-bedded department, and we have both FCPS neurology and MD neurology programs going on. We have a good number of house officers who can be abstractor for your study. And I have full backing from the university side to Mazhar Badshah and his team to conduct these studies. And we are privileged to have this study in our center to start with. And with these words, I would like to hand over to Mazhar Badshah to continue, please.
Thank you, Tanveer. Dr. Mazhar Badshah, please go ahead.
Thank you, Dr. Shahid. Thank you very much. Are you hearing me? You might not my video, but as I'm traveling, so it would be difficult for you to get my video. No so what we are doing is we are training neurologists here at PIMS. Not only that, we are running an electrophysiology lab. We are doing a lot of, we are having a number of fellows. Ali is one of our students who's working with Dr. Shoaib at Calgary in Canada. So what we like to do is we have already done a lot of research, and we find that we can have TPAs in our units. The government is denying the fact that we are not having a lot of neurology patients, and a stroke is not enough that we create a neuroscience institute. But what I can add is that this study would definitely have an impact for the reason is that we will have not only TP available in Pakistan, but we can introduce that in management of the acute stroke, as we have already discussed this with Dr. Shoaib and so many other people from abroad, that we can do that. We have did an audit on that we can perform acute stroke care in our units. Not only that, we are seeing a lot of patients from the nearby hospitals who are referring us to these patients. And I think that this will be a very good study. Not only that we will have an adequate amount of statistics that how many patients of stroke that we are seeing in single center, but in all over the country. And that would, I think that would convince the the government that we need to have stroke unit in every national hospitals. What we are being deprived of is that we are having stroke units in private sector, but not in the government sector. So this, I think this would definitely have an impact in convincing the government that we should have stroke units in the government hospitals.
Great.
Thank you very much.
Thank you, Dr. Basha. I mean, we know that you have done a tremendous work in the stroke world in Pakistan. You're one of the pioneers, actually, in stroke in Pakistan, and we look forward to working with you and in your guidance and in utilizing your experience. Next, I would invite I think if Haris is here, Haris Majid is the coordinator in PIMS, and if he's here and would say a couple of words.
Ji, Assalamualaikum. Thank you, Dr. Shahid, for the invitation. So it's an honor for PIMS Neurology to be a part of this project, and I would certainly like to appreciate the uniqueness of the idea of trying to improve the stroke care within the restricted and resource limitations. So I hope that in addition to the research aspects, the introduction of SITS registry, that would be very useful for not just study purposes, but improving the stroke documentation, and also we can improve on stroke care, and this effort can be then replicated in other public sector hospitals of the country. So thank you for having me, and
thank you. Thank you, Haris. Looking forward to. Thank you for all the groundwork. All the coordinators in all 4 hospitals really did a tremendous job in getting to where we are and getting to know them, and the abstractors also would know them and work with them. So next is District Headquarter Hospital, DHQ. If Dr. Shehzad Manzoor is there, he's the head of medicine department in DHQ Hospital. And if not, then Lubna Miraj is the coordinator in DHQ Hospital. Lubna, if you can say a few words.
Assalamu alaikum. I'm very glad to have Merit APPNA with us, and RMU is the having a 5 major chunk of the patient who drained in the RMU, and we have a lot of stroke patient before the COVID pandemic. During the COVID pandemic, the number is becoming less because of the fear and other reason, but we are happy to the part of APPNA MERIT study, and this is a very good step. We must give a good opportunity to the patient to improve their standards and treatment in the government hospital, and inshallah we are with you, and we are doing all our effort to give our 100% to you, inshallah.
Great, thank you. I think Dr. Shehzad Manzoor's, we should pray for his father's, passing in the last week, and hope Allah provide Jannat for him. But I think Dr. Jahangir Sarwar is here. He coordinated the whole thing. So our idea is from DHQ, not only DHQ, but Holy Family Hospital and Benazir Bhutto Hospital. All 3 hospitals of RMU eventually will become part of the stroke registry, and stroke unit will be in all 3 hospitals. If Jahangir is here and want to say a few words, he helped me a lot in coordinating all this. But
thank you so much. It is definitely our 3 hospitals are main hospitals of Rawalpindi, attending 3.2 million patients per year, and definitely stroke patients are very number of stroke patients is very high, and by this training, their management will improve and outcome will be definitely better as compared to the present scenario. And inshallah ta'ala, we will try to facilitate all the things, and we will like that this should not only be limited to the DHQ, but also to the Benazir Bhutto Hospital and to the Holy Family also. So all the people of Rawalpindi can benefit from it. Thank you, Shahid Bhai. Thank you for including us in this project.
Thank you, Jangir. Now, last, our study center, Dr. Hasnan Hashim. I think Hasnan, Dr. Salahuddin could not come probably, and so you can say a few words about Fauji Foundation in one or 2 minutes. Yeah, go ahead, Hasnan. Unmute yourself. Yes.
Yeah. So first of all, apologies from General Salahuddin because he was traveling from Lahore. So he already told me that you need to represent Fauji Foundation Hospital. As you know, Fauji Foundation Hospital is a 1,000 bedded. It is one of the largest welfare-based hospital in private sector. And previously, Ali know that because he was before me in Fauji Foundation. At that time, there was only one person in neurology department, but Alhamdulillah, now more than 22 doctors in neurology department. And previously, we had deficiency of the resident and house officer. Now we have inducted 5 neurology resident and residency programs has been started. So we have lot of people who are helping in collecting data and will help the abstractor as well. As far as number of stroke patients are concerned, we have a lot of patients because most of the entitled patients from Rawalpindi, Islamabad, and even from the periphery who are near to this Rawalpindi, Islamabad district. So they most of the time they have to come because they are entitled. So we have a lot of patients. So number of patients is not an issue for Fauji Foundation Hospital. Daily we 5 to 6 stroke patients we are admitting. So I think we are fully committed and we are very honored to be part of this project, and inshallah in the future, Fauji Foundation Hospital and especially neurology department will be on board for all kind of other projects related to the betterment of stroke care and neurology care in Pakistan. Thank you very much.
Thank you very much. Now we move to the organizations that are collaborating with us, and of course we already listened to SITS, the representatives from Sweden as well as from Pakistan, and the next is Pakistan Stroke Society. Pakistan Neurology Society is headed by Dr. Salim Baresh. I think his brother is really sick and he may not have time to join us. But Dr. Anjum Farooq is the president of Pakistan Stroke Society. And so Anjum, please say a few words about this program.
Thank you, Dr. Shahid. I'm honored to participate in inauguration of Merit Impact Study and SIT Strokes Registry in Pakistan. This is no doubt a great step to improve stroke care in Pakistan, and it is not just a study. I congratulate Dr. Hasnan Hashim as well to be appointed as National Coordinator for SITS in Pakistan. And on behalf of Pakistan Stroke Society, I just want to say one thing, that Pakistan Stroke Society is endorsing and will support it in future as well. Thank you so much.
Okay, thank you very much. So, Dr. Anjum, thank you for your support. Like I said, this program is Pakistan Stroke Society and Pakistan Neurology Society. We always, work with them. Actually, we need your guidance and all Dr. Mazhar Badshah and other colleagues in Pakistan, Dr. Hashim, because you are the one who really have the talent, know the ground realities, and guide us in a way. The common goal for Pakistan Stroke Society and here APPNA MERIT is to improve the patient care, improve the standard of education, improve the standard of research in Pakistan. And it's a common goal. So it's a win-win. So with that, I will invite the president of Pakistan International Neuroscience Society, as well as our new chair of APPNA MERIT, Dr. Danish Bhatti, to say, his perspective and also tell us a little bit about, or maybe Dr. Babar Rao will tell us about the conference that is going to take place in Pakistan. Danish, please go ahead.
Thank you, Shahid bhai. Assalamu alaikum, everyone. I just want to say three quick things. Number one, I want to re-highlight on the impact study that bottom line is that what we are trying to do is to improve the stroke care by very, very simple measures, what are considered the core measures for stroke improvement or outcome. And when we talk about stroke centers, which is a great idea, but there are many levels to it. You know, we often think about stroke centers as thrombectomies and doing TPA or IV, thrombolytics therapy. But a lot of care can be improved by simple things such as preventing clots or DVTs, giving aspirin on time, managing the blood sugars and fever, and very, very simple things. What we have defined as core measures in stroke. And that's something that's doable by anyone. It doesn't have to be a neurologist or not even a stroke expert per se. And the hope with the impact trial is to see if we can bring those core measures to eventually every place which sees a stroke patient. Number two, as the chair of APPNA MERIT, I agree with Dr. Shahid that we are strongly focused on improving healthcare in Pakistan through education and anything we can do as experts and give back to the country. In the end, you guys are the athletes and it's your race, and all we can do is a little bit of coaching or guidance and not anything more than that. So we're happy to do what we can with your guidance. And then lastly, as Shahid pointed out, that I'm also currently representing Pakistan International Neuroscience Society, which is maybe our founding member, Professor Ashfaq Shoaib, can tell a lot more about that. But it's the gathering of all the neurologists and neuroscientists from Pakistan in North America coming together to see how we can support each other and also give back to the country. So we have nearly more than 400 Pakistani origin neurologists in North America, which can be a big force of help and collaboration with Pakistan. So we will look forward to helping the neurology community in Pakistan in any way possible. Thank you, Shahid.
Thank you very much. So we are coming towards the conclusion of this program. I would like to give a minute or two to Dr. Babar Rao, who will be the chair of the host committee for the upcoming research conference in Rawalpindi Medical University, to say a few words about that. And then after that, I would like to acknowledge Waqar Hafiz, who's there, and give him 1 or 2 minutes to say that he would be part of our faculty there in the third phase of the study, as well as any other thing that he would like to share. And then we will conclude with Dr. Ashfaq Shoaib, and then our chief guest, Dr. Umar. So Babar, please go ahead, take 1 or 2 minutes.
Thank you, Shahid and Danish. I'm happy to be part of this team. And welcome to some of my friends there, Wasim, Jahangir Sarwar, and Tanveer Khalik. I know them personally. What we're doing in March is basically, it's sort of a fact-finding meeting where we want to know if a faculty or a student wants to do research, clinical or otherwise, in Pakistan, what resources they have, and what are the issues or what are the weaknesses which then we can help in that area. Obviously, it's your research. We just like this program. We want to help you to achieve it, but there are difficulties, there are weaknesses in the system everywhere. So we want to find that out, and we are working closely with the HEC, Higher Education Commission, and other institutes like NIH who are involved with research in Pakistan. So we will be there. We'll be sending emails and blast mails to see what we are doing. But I will invite all of you to be please join in whatever way you can. Thank you.
Thank you, Babar. I would like to also, Waqar, if you're there, please speak for a minute or so. I know you are there for, you're a neurologist in Maruf Hospital and very passionate about stroke education, and you are there. So we would definitely like to collaborate with you. And I know you have, worked with DHQ Hospital for some time. And as you have seen the design of the study, in the third phase, we will have to impart the education and stroke committees. And so you will be part of that. And of course, at any time, then you will also have the registry of SITs for your own hospital. Okay. So please say a few words.
Thank you. Thank you. I think this is the right time for this kind of opportunity. And then I must say that, I'm happy to see these kind of things happening in Pakistan. I've been in Pakistan for the last 3 years now, and but didn't see this coming. Another thing is that Maruf is also going to start its own research department. It's going to actually try to build a research trial center, and we are in process of that. So I think, again, this is the right time to do these kind of things, and I'll be happy to participate in any kind of educational or research programs going forward, inshallah.
Thank you, Waqar, and please, we will work offline and talk offline more about the upcoming conference. We would like, we know Mujtaba Qadri is there. We had worked with him when he was in NUMS, a great researcher, and then Mubin Malik, and so that team is very strong, and we would like to collaborate with your research department, and would like them to be an active part of this conference. So before I invite Dr. Ashfaq Shoaib, Mariam Malik, if she's there, she's the lead of the abstractor. We are creating a team of abstractors. These are either doctors, like Mariam has already done her graduation, and actually is in the process of completing USMLE, but she has already 3 members with her, and then she's working with ORIC Office of Innovation and Research in RMU for this whole project. So if Mariam, you're there, if you want to say a few words.
Yes, yes, thank you. Thank you. I would just like to say that thank you for having me. And yes, we currently have a team of 3 members right now, and we are collaborating with Rawalpindi Medical University and the ORIC team and the entire research unit, and they have been very helpful. Thank you for all the support, and we will be working with them, and we are here looking forward to the entire project. Thank you.
Thank you, Mariam. So Dr. Ashfaq Shoaib, as I think most of here, everybody knows him, but he is, the pioneer, the founder of all the neurology and stroke, not only in Pakistan, but a renowned name internationally. Very renowned researcher, very renowned stroke leader. And so we are so happy and glad that he's with us as an advisor, and always as a big brother, available for any question, any cooperation and support. So we always really appreciate his support anytime. So Professor Ashfaq Shoaib, please go ahead.
I think just recently, I think for some reason he lost his connection.
Okay. So let me see, Waleed, if you can connect to him. Asim, you wanted to have 1 minute. You wanted to say something?
Shahid, just to for the trainees, I think in Pakistan which are attending the meeting might be just to let them know, if they want to get some training in stroke medicine, there are opportunities to become a stroke registrar in UK. So I'm more than happy to help them. Obviously, not all of them, one or two of them in a year or 2 years period. Another thing is the stroke masterclass we do annually. It might be, obviously, it would be good for learning purpose. So I would be able to share the link on this APPNA MERIT. If anybody want to attend, the next upcoming is on 18th of February. That's all I have to say.
Thank you. That is a good resource, Asim. I think all of the people who are here. So Dr. Ashfaq Shoaib is back. I introduced you in your absence, I think, and it's good that we said few things about you on your back. All good. So please go ahead. In the interest of time, we have to wrap this program up, and you are the second last after this chief guest. RMU Vice Chancellor Dr. Umar will say his concluding remarks. So Dr. Ashfaq Shoaib, please give us your guidance and your impression of the whole SITS registry and the impact study.
Certainly. Assalamu alaikum, and thank you for your invite. I'm honored. Let me say that in my 30 years or so of experience over the years, it is the people behind projects that are key to success. So I would like to, first of all, acknowledge, Shahid, your work and Danish's work. You've been working very, very hard behind the scene. So thank you for your efforts. It also is very clear from all the, the professors and vice chancellors of the various institutions who are on this call, that to me is a clear indication that there is a very profound interest that this process and project succeeds. I do agree with Danish that you have to keep your project simple and the goals achievable, and have research that's locally very very important. So healthcare, and especially care of stroke patients, is somewhat of a neglected field, and one can, I am sure, through a process of what has been outlined here, move it in a positive direction very quickly. I have two important comments. My first one is I'm really excited about this research meeting in March. It is very timely for your initiative for impact. It's timely because it'll give you an opportunity between now and March to do what you've set out, your initial work. So I would implore and insist that you consider having a investigators meeting of sorts, or a symposium on the sidelines of this conference, where you get all these people from various institutions that are participating together and give a progress report. What this would do is they'll give them it'll give them that incentive that they will present, and at least they'll have comparative presentations from various hospitals. So this is a godsend opportunity for you. My second and last comment in here is that I am convinced, absolutely convinced, that unless you have a stroke ward or a stroke unit or a designated stroke area, you just cannot take care of stroke patients. So when I hear the PIMS report that they're admitting 4 to 8 patients a day, I think they need to have a stroke ward or a stroke unit, as do other hospitals. So I'm hoping that this initiative would give you all, including me, give us an opportunity to work together to at least showcase, like what you have in at least 2 of the participating centers, that the others could also do that. and work towards stroke units. So excellent work. You've got a great team. I'm looking forward to collaborating with all of you. May you have success, and may Allah help us all in this important endeavor. I'll stop here.
Thank you, Shagwa Islam. This has been always a great. Your presence is always very encouraging, and of course you're always willing to work and go wherever we invite you and do and seek guidance. So with that, I think we are coming to the end of the program, and I will invite our chief guest, Vice Chancellor of Rawalpindi Medical University, who is actually the host of our upcoming March research conference 2 years in a row. We are very thankful to RMU, which is my alumni alma mater. And so I'm very proud that Dr. Umar has taken it to a next step, and always willing to help and coordinate and participate in any project that APPNA MERIT has or need collaboration with. So Vice Chancellor Dr. Umar, please go ahead.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. I think it was such a motivational meeting that I was thinking that I should stop gastroenterology practicing and become the neurologist. And secondly, I think I appreciate Dr. Shahid Rafiq's effort. At least he's in touch with me from last 10 years to establish this program. And finally, I think today's meeting is just one of the start of this. And I'm very happy and pleased that we are hosting a research conference, and we are the bigger partner of the merit study. I think the APPNA MERIT is writing a new history in the leadership of Dr. Shahid Rafiq and Dr. Rao Babar and Danish, that in last 1 year, two things have changed. One is the post-COVID world, and the other is the APPNA MERIT, the work and contribution they have doing for the Pakistan. So my congratulations to Dr. Shahid and the team. I think the world has become the global village, and the universities of Pakistan must have the vision to be the part of this village. I think briefly the RMU have already started a program which is called as the Global E-Learning Initiative of RMU. And we are been the partner in many programs with APPNA and APPNI and other countries. I think that's our honor to be the part of this program also. I think coming to the research, I think the research, we are the first inshallah university which has established a small research unit with the support of Ramkana and our own Ravenians, not only contributing guiding us, but huge financial contributions. Coming to the impact study, I think this is the dream coming true, where this study will be, I think in my knowledge, this will be the first study which will be on grounds and really practical learning of the research, not only making, only webinars, but this will be something on the grounds. We all understand that we have the stroke in Rawalpindi Medical University Allied Hospitals are the third most common cause of admissions. So in an emergency, that the third most common cause of admission is the stroke. This is what the data is from our centers. So I think this is the high time to do this study, and I strongly agree that only way forward is to develop the stroke unit in at least teaching hospital and developing a network from the BHU to the Tehsil hospitals and then teaching hospital and district hospital. This is the way forward to save human life and improve the stroke patient care. I think the impact study will not only collaborate with the ORIX of the university, but it, as rightly said by Dr. Shahid, it will be a great opportunity of capacity building of the researchers, students, the consultants, the general physician, as well as the neurologist in Pakistan, and particularly the twin city of Rawalpindi and Islamabad and Wa. I think this is the great study as a research initiative, and I hope it will be completed and published in a good impact fact journal, which will again a capacity building to our researchers. Ultimately, whatever training and capacity building we do and the research will do must benefit the patient. And as already said, that this study result ultimately will help us to establish the stroke unit and formulate the guidelines for a resource-constrained country. With these simple intervention, we can save many lives and reduce the mortality and morbidity. And finally, I warmly welcome to everybody to the March Research Conference in RMU. And thank you once again. And I also learned that the chief guest must be patient for 90 minutes to see his comments. Thank you very much indeed. Thank you, everybody.
Thank you, Dr. Umar. It's always a pleasure to have you, an honor. And thank you for all the guests and attendees for, and apologize for running over 1 hour. But as you could see, we had such an illustrious long list of guests and speakers and scholars. So I would, in the end, thank everyone from Canada to North America, Canada to USA to UK to Sweden and Pakistan. It was a truly international webinar meeting, and I thank all of the participants and the chief guest